Essentially, in order to break an addictive pattern, to become unaddicted, 30 days of zero interaction with that substance, that person, etc.
You only need 30 days
Wow.
to break an addiction.
Like, just stay away from it completely.
And Ramadan, what better time to do it? We've got 4 weeks, we've got the 30 days, we've got the environment. So just, we just need to pick a bad habit and just delete it. Of course, initially it's going to be difficult.
All we need to do this Ramadan is pick one bad habit and try our best to overcome it. So Ramadan is here, the month that Muslims have been waiting for throughout the year. And it's the month where we can really break bad habits, addictions, anything really.
Yeah, exactly. You can break a bad habit, especially in the month of Ramadan and any addictions that we have. And the reason for that is, of course, we've got that spiritual environment, everyone's focused.
Of course, yeah.
But also, according to the latest research in the scientific world, you only need 30 days to break an addiction.
30, exactly
30 days.
Wow.
And arguably one of the most renowned addiction specialists in the world is out of Stanford. Her name is Dr. Anna Lembke.
Right.
She's been in all sorts of podcasts and she's been explaining
Dr.
addictions.
Huberman had her on his
Dr.
podcast.
Andrew Huberman had her on as well. And she explains that from her clinical experience, it just takes 30 days for someone to break an addiction, to overcome that first hurdle of ending.
Which is very, very hard.
Exactly.
Of course, yeah.
Extremely hard.
Yeah.
But you only need 30 days.
Wow.
So just listen to her. Let's listen to her.
I've heard you say that in order to reset the dopamine system, essentially in order to break an addictive pattern, to become unaddicted, 30 days of zero interaction with that substance, that person, etc.
Right.
Is that correct?
Yeah. And 30 days is, in my clinical experience, the average amount of time it takes for the brain to reset reward pathways, for dopamine transmission to regenerate itself. There's also a little bit of science that suggests that that's true. Some imaging studies showing that our brains are still in a dopamine deficit state 2 weeks after we've been using our drug. And then a study by Schuckett and Brown, which took a group of depressed men who also were addicted to alcohol, put them in a hospital where they had received no treatment for depression, but they had no access to alcohol in that time. And after 4 weeks, 80% of them no longer met criteria for major depression. So again, this idea that by depriving ourselves of this high dopamine, high reward substance or behavior, we allow our brains to regenerate its own dopamine for the balance to really equilibrate. And then we're in a place where we can sort of enjoy other things.
So look, 30 days to reset that imbalance which the addiction has caused in the dopamine system. That's all you need. That's all we need. And Ramadan, what better time to do it? We've got 4 weeks, we've got the 30 days, we've got the environment. So just, we just need to pick a bad habit and just delete it for 30 days, and it's going to literally have a long-lasting effect.
We're staying away from so many things anyway. For example, eating, drinking, what we're otherwise allowed to do throughout the year. So if we're staying away from things which are halal for us, then of course things which are haram, it'll be much easier to stay away from them as well.
It creates that environment.
And he said it as well. He's like, just stay away from it completely. And Ramadan is the perfect time for that.
Exactly. They actually go a bit further, which we'll listen to. Have a listen to this.
Yeah.
So I'd like to dissect out that 30 days a little more finely. And I also want to address, how does one stop doing something for 30 days if the thing is a thought? So we'll kind of put that on the shelf for a moment. So days 1 through 10, I would imagine will be very uncomfortable.
Yes.
They're going to suck, basically, to be quite honest, because the way you describe this pleasure-pain balance, to my mind, says that if you remove what little pleasure one is getting, or a lot of pleasure from engaging in some behavior, that's gone. The pain system is really ramped up and nothing is making me feel good. I'll just use myself as an example. I'm not in recovery, but that 10 days is going to be miserable.
Right.
Anxiety, trouble sleeping, physical agitation, and to the point where, maybe impulsive, angry. Should one expect all of that? Should the family members of people expect all of that?
Yeah. So what I say to patients, and it's a really important piece of this intervention, is that you will feel worse before you feel better.
For how long?
Yeah.
This is probably the first question they ask, right?
And I say, usually in my clinical experience, you'll feel worse for 2 weeks. But if you can make it through those first 2 weeks, the sun will start to come out in week 3. And by week 4, most people are feeling a whole lot better than they were before they stopped using their substance. So you have to, it's a hard thing. Like, you have to sign up for it. And I will say, obviously, there are people with addictions that are so severe that as long as they have access to their drug or behavior, they're not able to stop themselves. And that's why we have, higher levels of care or residential treatment. So this is not going to be for everybody, this intervention, but it's amazing how many people people with really severe addictions to things like heroin, cocaine, very severe pornography addictions, I posit this, and I do it as an experiment. I said, let's try this experiment. I'm always amazed, number one, how many of them are willing, and number two, how many of them are actually able to do it. They are able to do it. And so that little nudge is sort of just what they need. And the carrot is, there's a better life out there for you, and you'll be able to taste it in a month. You really will be able to begin to see that you can feel better and that there's another way.
So look, they broke it down. Like, of course, initially it's going to be difficult. And even in Ramadan, we know that the first fasts, they are difficult.
Yeah.
But then you get into it and then it's easy. So like week 3, she says that people start seeing that difference when they've left it. And week 4, most people have changed.
And you know what she said? It gives us a lot of hope, because she even mentioned the toughest habits to overcome. So in a nutshell, all we need to do this Ramadan is pick one bad habit and try our best to overcome it. Hazrat Mirza Ahmad MA, the son of Hazrat Mirza Ghulam Ahmad, the promised Messiah, he actually said this in an article. He said that the promised Messiah said that in Ramadan, we should always try to pick one bad habit, just one bad habit, and try our best, make a promise to God to overcome it. And by the end of it, it will happen, inshallah.
Inshallah.
Yeah.